patient who has HBsAg positivity in pregnancy. So this is not a very uncommon problem, and we see people of HBsAg who are non-pregnant, and we also see patients who have HBsAg positivity in pregnancy. Because of the HBsAg positive rate in the community being around 3% or so, probably it has come down from 5% which was earlier. Still, we do find people who have this issue of HBsAg positivity in pregnancy. Now, this patient happens to be the relative of our staff who are working in our hospital, and who also are these people these are people are working in the gastro department also. Now, they have come out with some questions. So let's answer these questions about this problem.
Sir,
What do you have? What is the question you have got in mind?
one of my relative who is pregnant now. She is HBs positive in her pregnancy. So how it will be affected her?
So see, this HBsAg is a B virus.
Yes.
So the antigen is positive, and she has no jaundice. Her LFT I have seen is normal. So the liver is not got affected. Only the HBsAg is positive. So, and our main aim in the pregnancy is to see that the fetus doesn't get affected. So we need to do some tests and find out what is the level of the virus in the blood. If the level of the virus is high, we need to give antiviral treatments. The main idea in this situation is to prevent the infection of the newborn. So the fetus doesn't get affected. It is a newborn that gets affected. So the transmission occurs during delivery. So that is the area where we have to protect the newborn. So anything else you have got in mind, and some more details would you want?
So what we can do?
What we can do is we can do the HBV DNA of the blood from the blood test from the mother, and then assess the value. If the blood HBV DNA is more than 2 lakh international units, we need to treat the mother with antivirals. So the cutoff value seems to be, according to the present recommendations, 2 lakh international units per ml of blood. So if it is more than that, ideally we should be treating the mother with antivirals so that the transmission to the baby does not occur when it occurs at birth. So we have to cut down the transmission if the level is high. But if the level is low, we don't have to do anything, antiviral treatment is not needed. We have to give HBsAg and HB vaccine to the newborn around birth, after birth, and in a few hours. But if the viral load is high, we have to treat the mother, reduce the viral load so that the transmission doesn't occur. Higher the viral load, higher the transmission. The lower the viral load, lower is the transmission. So that's why we don't have to expose the mother to antivirals if the viral load is not high. What is this level? It is around 2 lakh international units, 2 lakh international units per ml of blood. This is the HBV DNA.
Yeah. So what we need to do if the pregnant lady is HBsAg positive?
So obviously now the situation is the same thing. So we will do the HBV DNA and then LFT and then if possible HBeAg and other markers, and if the load is high, and we will treat with antivirals. We will start the treatment around 24 to 26 weeks around that time, and then follow it up till birth. And then we stop the medication, and then we will assess what to be done for the mother and the child. So basically, if the viral, we will do the viral load. If it is high, we will give the antivirals. If the viral load is low, then we will follow up and give the HBsAg and Hepatitis B vaccine to the newborn. Okay. So let's see how the test will come out.
So what is the treatment, sir?
So the treatment, as I suggested, is the antiviral. The antiviral is, we have a few antivirals like entecavir and tenofovir. So tenofovir needs to be used in pregnancy. We cannot use entecavir in pregnancy. Tenofovir is a drug we need to use, and we'll start around just after 24 weeks and continue till birth. So let's use tenofovir in our case. depending on the again viral load. If viral load is high, we will use, otherwise not.
So what is the follow-up for the mother and for the follow-up for the child?
Okay, you're asking difficult questions now. So the follow-up for the child would be, the child would receive definitely, if the mother is HBsAg positive, the child will receive the HBIG as well as the hepatitis B vaccine. So this will be given by the pediatricians nowadays. Nowadays, as soon as the birth takes place, the pediatricians will look after. So they will give this passive immunization, that is HBIG, and the active immunization, that is a HBV vaccine. They will give at start at birth and continue it and follow the child. But we need to know if the child has got infected, despite all the measures, the child has got infected or not. Around 1 year time, we can do the HBsAg and then find out. If the HBsAg is negative that time, I think the child has not got infected, and we are able to protect that. We have, whatever exercise we have done has protected the child against the B virus. Then regarding the mother, we have to follow up once the, basically we stop the medication at birth, let the mother feed the child breastfeeding for about 6 months or so, and then we can reassess the mother by LFT, HBV DNA and HBeAg, and then accordingly we carry on as we routinely do for any other patient. So let's hope our patient does well, and let's carry out with these tests what we have planned, and let's carry on and find out. I think in the next 4 to 5 days we'll get the results, and we'll find out the results and we'll call the lady. Okay.
Thank you, sir.
Bye.